this summer. So I'm by no means an expert on critical appraisal of journals, but as we have all this free time and this quarantine, I hope that everyone's reading more scientific papers, looking at more trials, and I hope that maybe we can give you a broad overview, as well as some of the skills you can use and resources you can use to critically assess and use some of these resources that are being published. So just a little bit of background. So critical appraisal journals isn't just used in healthcare, it's used across the board amongst all journal article types and all different professions. But generally speaking, critical appraisal is a systematic process to determine the strengths and weaknesses of an article in order to assess its validity and usefulness. So we know that, there's plenty of research out there, there's plenty of published and unpublished works, and not all of that is of high quality. Maybe just because it's published, we think that it's valuable and we can cite it and use it in our own research and our own discussions, but you really need to look at these things with a critical eye and decide, did they do the right things? Did they set up things in the right way to make it useful to me and useful to my research? So like it says here, why do we need critical appraisal? It's essential in helping us to compile valid and useful research. So not just all of the content that's out there, not just all of the information, but really honing in on what's going to be important and useful to us personally. And then what can be critically reviewed? Anything. While we'll focus a little bit today on some of the quantitative skills for numerical data and some of the randomized controlled trials, any type of paper can be reviewed, be it a systematic analysis or review, a qualitative quality improvement study, or even just an opinion article. Those can also be critically evaluated. The tools will be a little different, and we won't have time to cover all those different types of tools today, but hopefully there'll be some resources at the end to kind of give you some checklists and some guidance on how to critically appraise depending on what type of article you have and what you're looking at. So just to start us off, this is a quote from the CASP organization. Critical appraisal skills enable you to assess the trustworthiness, relevance, and results of published papers so that you can decide if they are believable and useful. So I think the main part of this, the important part of this quote is that so that you can decide. Anyone can tell you what they think is important and useful, but it's up to you to have the skills to critically assess some of the decisions that authors have made in data, in methods, so that you can decide if it's going to be useful and not just rely on some of the remarks or conclusions that the authors themselves come to, because those might be biased, they might not be as strong as we would like them to be. So this is just to show you the hierarchy of evidence. So today we'll be talking about randomized controlled trials here in the middle of the pyramid, but this is just showing you kind of how strength of evidence is stronger when we compile systematic reviews here at the top. And what that means is that performing critical analysis on all of these sub-pieces, like the randomized controlled trials, and culminating them into a strong systematic review, that's what's going to be the strongest pieces of evidence that we have. But we're going to have to do the hard work, and we're going to have to take these randomized controlled trials, these cohort studies, case reports and case studies, and we have to do kind of the hard work to make sure that they're worthy of being but by all means, obviously, this critical analysis can be performed on randomized controlled trials alone, and critical analysis can also be performed on systematic reviews themselves. So if you're the one who's compiling a systematic review, you're going to be evaluating, individual trials and studies, but then you can also take someone else's work and their review of available data and kind of do a critical analysis of that as well. So where does critical appraisal fit into the research process? So you can see here, it's going to start with the orange, or the red circle or pie wedge up at the top, and that's where we're defining a question. So once you have a question that you want to evaluate, you want to look into, whether it be, a clinical question, how to care for patients, how to best inform our healthcare work, that's going to be your defining process. And we had a previous webinar by Dr. Renley, and she gave a great presentation on which resources to use to search for articles, how to find a good search engine, how to really narrow down our topics to really get what we want out of those search and database engines. and that would be based on how we defined our question and what we're looking for. So that would be the define and the search aspects, and that's going to be, kind of compiling things based on what questions we're trying to answer, what clinical case we're working on, and that'll be the start of our process. And then here in this yellow wedge, we can see kind of where our conversation comes into play, and that's the appraisal piece. So after we found all these great articles, we found some great randomized controlled trials about a new drug for our disease state of interest, but how do we know that those trials and those papers are going to be valid and useful for guiding our final decisions, whether it be a patient care decision or developing even a guideline? So for appraisal, that is when we're going to take those articles that we found and we're going to critically and efficiently appraise the information that's contained in those articles, whether it be qualitative data, patient outcomes, or more quantitative data that has some statistics and analysis that we can look at as well. And then we can see how those articles, after we've appraised them, can be synthesized and combined. So we can kind of use similar articles or articles that are going to be pertaining to the same topic. And we can use those to generate a final opinion based on all the available high quality literature that's out there. And eventually over here in the darker blue colors, we have the implement. So if you were trying to make an informed patient care decision, whether it be about starting a new medication, a new procedure, or just kind of continuing care in general, whether it be for diabetes or hypertension, that's when you take all the data that has come out of these articles that you've searched for, you've appraised, you've put together, and then hopefully that'll be available to you to guide your treatment decisions and guide your pharmacy practice. So some general guiding questions to ask for any critical appraisal that you're going to take part in. Is the question focus of the study clear? So what does this mean? Do they focus in the title or in the main body of the paper, do they focus on something that's going to answer the same questions that I am looking to answer? So this just means don't get bogged down by papers of similar nature. Let's say you're trying to learn more about diabetes care. Just because it's about diabetes doesn't necessarily mean that it's going to give you the data you're looking for to guide a new treatment option. So if you're looking for a specific type of medication, you want to make sure that not only are they looking at the population you want to look at, but are they looking at the interventions and outcomes that you're looking to find as well. Another general guiding question would be, are the methods used and the analysis used valid, and can they be reproduced? So that means that if we're speaking specifically about randomized controlled trials, we want to make sure that the methods that the investigators employed and the analysis they use to kind of judge their outcomes, that they're not only that they're valid and useful, but that they can be reproduced in another setting. As we know, not every country, not every investigation team is going to have the same patient population. So we want to make sure that things are similar enough that they're usable, and they're not only particular to one different location and can't really be reproduced or used anywhere else. And this would also lead us to, are the outcomes measured useful or meaningful? So if we're, again, talking about a population with diabetes and we're trying to see if a new diabetes medication is useful, we want to make sure that we're collecting outcomes and assessing outcomes that are particular to that medication and to the disease state. So while hypertension might be a valid outcome in another study, particularly for a heart medication, cardiac medication, we really want to focus on what outcomes will be important in determining the intervention that we're trying to assess. In this case, a diabetes medication, your outcomes would be blood glucose, mortality, and other associated outcomes that are very particular to a diabetic patient and the intervention that they're trying to study. Ultimately, information from critical analysis, kind of like what we looked at in the hierarchy of information, it can be used in multiple different ways. So it can stand alone and be used in single research argument and synthesis. So if you're trying to come up with your own research paper about a topic, you want to make sure you're performing critical analysis on all of the references that you're going to be citing in your paper. You want to make sure that your final product is built with high quality resources and resources that are going to be convincing as well as accurate. Compiling these types of articles and using this type of critical analysis also allows us to make system or policy change. So let's say you're trying to convince the head of a hospital or the head of a pharmacy to start a new program for patients or to make a policy change. If you were to come to them with an argument, you want to make sure that that argument is backed up with high quality evidence, as well as the outcomes that are going to be most convincing to whoever you're trying to convince. As well as at the bare bones, you have patient care decisions. I think in pharmacy, it's really important to not just look at expert opinion and not just look at guidelines, but to also evaluate some primary literature, randomized controlled trials, case reports, just to make sure that you're evaluating all the available literature and guiding care for your patients. So this could be outcomes of a particular medication, or it can be a patient care process such as caring for a patient in an intensive care unit. You want to make sure you're not only just looking at developed guidelines, but you want to look at some of the case reports that have come out of this patient population and to decide if they're useful to you and if they can be useful in guiding your decisions. But then that also does lead us to guideline development. So we know that throughout the years, over time, when new drugs are developed and approved, when new studies come out about new interventions, all of those studies throughout the years are collected, analyzed by a group of professionals, and that's what eventually becomes our guidelines. So, and when you look at guidelines, you know that critical appraisal has been done of all the available primary literature, all of the case reports, all of the outcomes have been evaluated in order to make really strong and really well-informed guidelines for care. And that's not just in pharmacy, that's amongst all healthcare professions and amongst other professions as well. So the bottom line for kind of starting on critical analysis of anything, of any paper type, is to consider two following things. Can the results information be trusted? Can I trust these outcomes? Can I trust this author's opinion of these outcomes? And what aspects do they include in their article, in their paper, that allow me to trust it? And we'll kind of go through some of that. As well as, do the outcomes even matter? So kind of like what we talked about before, you want to make sure that you're looking for papers and articles that answer your specific question. You want to make sure that the outcomes that they collected are truly reflective of whatever question they're trying to answer, and don't kind of cloud the waters a little bit and make it seem like a good idea or make it seem like a good intervention, when really they didn't collect the outcomes that would truly show its true benefit or its true risk. So just a little bit of a roadmap when you're going to be going through a critical analysis and collecting research. First, you want to establish your needs. And this kind of goes back to the defining your question piece. So what do I need out of an article? What am I looking for? What patient population would I like to have been studied? What intervention would I have liked to have been studied? And I need to go about finding those and establishing that as my main, and not getting distracted by some of the other materials that are out there. Secondly, you want to search for bias or conflicts, and we'll go through a couple different forms of bias and how that kind of impacts our results and the validity of those. But you also want to look for conflicts. So you want to make sure that the authors are honest and altruistic with their authorship and their product. You want to make sure that if anyone's being funded, that it's not going to be conflicting with some of the outcomes and making them less valuable. We can't really trust things if we know there's going to be some confirmation bias. If a drug company is specifically funding a trial on a drug they're looking to get approved, you want to make sure that their outcomes aren't just favorable and for the drug and completely ignore also the negative side effects that have come out of its use. You also want to define who is studied. So this kind of goes back to establishing your needs. So you want to make sure that you're looking for papers and evaluating whether or not the population that was studied is useful for that particular question. So if you're talking about hypertension and some of those consequences and organ consequences of hypertension, it might not be as useful to look in pediatric or children populations when you know that really the most affected populations by hypertension are going to be those who are a little bit older. So you want to make sure that you know who's being studied, and that's something right away that you can pick out to determine if it's going to be something that's useful or something it might not be as useful. Next, you want to find out what happened to that population. So this would be evaluating and looking at what outcomes the authors choose to include, as well as how often those outcomes occur. And those outcomes can be positive or negative. It could be, if we're still speaking about hypertension, it could be, lowered blood pressure over time and following those patients, and that can be an outcome, how much their blood pressure was lowered. But could it also be negative? It could be, incidences of heart attack, of stroke, of blood clot. So other things that have happened to these patients that could indicate an increased risk or just a decreased quality of the intervention. So both of those you want to look at and when you're looking at outcomes and what happened to that population. Now, once you've kind of decided what outcomes you have presented to you, you want to determine their relevance. So kind of like we were just mentioning, like with the hypertension case, if you have a children population and you have this great, trial on hypertension, you want to make sure if those outcomes are really going to be relevant if you're trying to guide care of a different population, or if the outcomes aren't going to be useful in what specifically you're trying to decide for your patient. You want to make sure that whatever trials you are including in your research and your papers, you want to make sure that they're relevant to the topic you're trying to convince others of. And then one last thing that you want to try to do when evaluating research papers or journal articles is ignore potentially opinionated parts of text. It's very easy to kind of get caught up in the intro and the conclusion of papers and kind of go along blindly with what authors are saying and how they're interpreting their data. But you really want to use a critical eye and make sure you yourself are evaluating the statistical methods used, the outcomes reported, and using your own judgment to decide if this is going to be something that's useful, if it might be opinionated or biased, or if it's just a bad study altogether. So when you're doing that initial setup and you're trying to establish what kind of articles you're looking for, what kind of articles am I going to be evaluating to be useful? Sorry, guys. You want to establish a question. And I'm sure many of you have heard of the PICO format. So this is just an easy way to kind of cover all your bases and find out whether or not an article you're assessing is going to be useful to you. You can do a quick PICO question of both what you're looking to find and as well as the article you're evaluating, and see if they match up. So PICO stands for patient would be the P, and that's kind of establishing your study population, which patients were studied, is it the same patients that I would like to study? The intervention, the I. So in the case of a diabetes patient, you want to make sure, am I looking at patients receiving insulin and those outcomes, or am I looking at a patient receiving an oral medication and those outcomes? So those are two very different possible interventions for patients. You want to make sure that whatever you're looking at in other articles and other trials is going to mirror the interventions that you're looking to evaluate, and not just a diabetes trial in general. For C, we have comparator, and that kind of goes along with intervention, meaning that you want to know that not only the group that you're studying a new drug or trial or procedure in, that those match up, but also that they're being compared to something that you would also be able to compare to. Normally this is done through, a placebo group or a baseline group who doesn't receive any treatment, and that's just to see how patients would progress with the natural course of disease or the natural course of whatever you're looking to evaluate without that intervention. So not only do you want to make sure that the actions that you're trying to make are the same, but also that they're comparing them to something that'll give you equal outcomes and won't be skewed in either direction depending on if they compared it to a healthier group or a more sick group. You want to make sure that the articles you're assessing have that kind of similar baseline so that your data isn't all over the place, and some might look better than others based on that other population that they were testing against. And then finally, like we said, we want to look at those outcomes. This is going to be the most, the meatiest part of your analysis, especially when you're trying to guide patient care decisions or guideline development, or even just your own research paper. The outcomes are going to be what guides your general opinion. So you want to make sure that those outcomes are valid and they're reasonable. If something sounds too good to be true, it probably is. So you want to make sure that they came about those outcomes in a reasonable way, and that it's not just due to chance alone. Also that the analysis that they performed is statistically relevant and useful, and not just kind of showing and highlighting like marginal improvement, but showing truly how the outcomes were come about and how they impacted the patient population. So evaluating outcomes on your own with your own critical eye is going to be super important in evaluating research. So then finally, once you kind of have set up what you're looking for, what articles you're looking for, and how we can go ahead and start picking out quality pieces to evaluate, we're going to want to establish your needs. So we've kind of gone over this a few times in a couple different ways, but ultimately your needs are going to be defined by what outcomes are you looking for. Do I want to see if a new diabetes medication is going to make people healthier? We would look at outcomes like reduced blood sugar and, reduced mortality. So we want to make sure that the outcomes that we're looking for are reflected in those articles that we choose to evaluate. Additionally, what populations are you interested in? And we've mentioned that before as well. So making sure that if we're looking for articles to guide therapy in a group of older adults, we want to make sure that the articles and trials that we're assessing also implement those changes in the same population of older adults, so that some of the data, it might look better if you have a group of children. Oh, their blood pressures are a lot better. Well, is that due to the treatment that we gave them, or is that just due to them being a little bit younger and a little bit fitter than their parents' generation? So making sure you have those both well defined before starting to analyze and use outcomes. So just a little bit further into establishing your needs and some of the things you can do right off the bat before even really getting into a paper and getting into the statistics and the outcomes. Here's some of the things you can do kind of at the surface level. So first, you can evaluate the title, and that'll help you right away in determining perhaps what the major outcomes that they were looking for were. Generally, it would also tell you a little bit about the population that was studied. So it'll give you right off the bat a good idea if it's something that you can pursue into evaluating, or if it's something that might not be as useful. Then right off the bat, you want to establish the comparison. So like we mentioned before, you want to make sure that both groups that you're looking at, not just the one that's receiving the treatment, is going to be useful in your analysis, because that's where the outcomes are going to be derived from. They're going to be analyzed against this comparison. So you want to make sure that you kind of have a similar idea of what kind of groups you're looking at and how that's going to impact your final outcomes. Again, we want to define the population. We've kind of gone through that enough, so I'll go ahead and skip that one for now. But of course, you want to make sure that you're studying the right population that you want to study. Assess the outcomes measured. And they can do that in a couple different ways. There's a couple different kinds of outcomes. And depending on what type of disease state you're looking at, there could be surrogate outcomes as well. So it might be difficult to judge certain things clinically. So a lot of times articles will use other measures like blood pressure or blood glucose to determine how healthy a patient is, because you really can't directly assess health. You have to assess all these other factors that could impact that patient's health. So just making sure you know which outcomes are measured and how that applies to what you're looking for. The study strength, and that's going to be assessed by you by evaluating the methods. And we'll go through some of those tools that articles employ to prove that they have, good methodology, are reproducible, and just make sense, and, are clinically useful. So you want to make sure that the methods are strong and reproducible, and relevant, as well as the statistics. So both there's a lot of different statistical components that go into evaluating an article, and that could be its own webinar in itself. But there's statistics that come into just when you're developing, a population size you want to study, as well as when analyzing outcomes. You'll use a different set of statistics to kind of show you if there's any change and if those changes are relevant. So you can have a change in 2 different patient populations, but it not be enough to be significant. So we want to know that the changes that we're seeing, the outcomes that we're seeing, are actually going to be useful in a clinical setting. And then conclusion. So if you're like me, usually you kind of do get into the trap of reading the conclusion first to kind of see what your authors came up with of their own analysis. So the conclusion is where you're going to find, here are outcomes, and here's what we think our bottom line is, or what our end message is. And oftentimes this end message is a best case scenario. So they don't always, hone in on some of their mistakes, some of their shortfalls or their limitations of their studies. And that can be detrimental when you're trying to, amass a research paper or a guideline. You want to make sure that the authors aren't purposefully leaving things out, or that they aren't being framed in a way that makes them seem better than they are. So that's why you're going to have to utilize your own critical analysis skills and kind of look beyond the author's conclusions and make your own conclusions. So just some general aspects to assess across all different paper types, not just quantitative random controlled trials, but all journal articles that could be applicable to healthcare. So like we've already mentioned, and some of this might be repetitive at this point, but the clinical question that they're looking to answer, does this new medication improve this condition, as a black and white, and then the outcomes of interest. So did it make a change in them? And then how are we measuring that change and whether or not it's a valuable change? So we want to make sure both of those are being done by the article in question. Like we've already mentioned a couple times, the population assessed, it's super important. You want to make sure that, the population that they've recruited for this trial is going to be a population that you can reproduce if you were to do the trial yourself. So that they have similar baseline characteristics, and hopefully then the outcomes can be appointed to the actual intervention and not just some, baseline characteristics that weren't accounted for. So perhaps maybe one of the population groups is just inherently healthier. That's something that we would like to know before going into an analysis, so that we know if the outcomes are truly representative of the intervention and not just some aspects of the population that we studied. The methods utilized are also very important. So we want to make sure that if we are looking at, a random controlled trial, that they blinded appropriately, that they blinded appropriately, that they randomized patients to each group appropriately. So we know that if, like, kind of going back to the population assessed, if all of our sickest patients are in our intervention group and our placebo group is very, very healthy, our outcomes aren't going to be as representative of the intervention as we would like them to be. So we want to make sure that those methods in the beginning, when you're setting up a trial or any kind of paper, that they're setting them up for success and not for bias. Like we've already mentioned, the outcomes collected are super important in a variety of different ways, making sure that they're relevant to the clinical question at hand, and also relevant to the intervention being studied. Analysis strategies. So this would be done on outcomes. Once we kind of have our outcomes data, usually in this case it would be quantitative, but you can also do this for qualitative outcomes as well. But for quantitative outcomes, we want to make sure that they analyze the numbers and analyze the outcomes in a way that will truly show if there's a significant or clinical difference. Oftentimes, things can be analyzed incorrectly, and this makes, there seem to be inflated clinical benefit to something when really it's no better than placebo. But based on the way that they presented and analyzed the outcomes, it seems like there might be more benefit than there is. So we have to kind of look into those analysis strategies and make sure that they're useful, and also make sure that they're relevant to the topic at hand. And like we mentioned before, the conclusions, while it usually is a best case scenario, it might not always be, it might be a little sugar coated by the authors. It is a good thing to read and to kind of see what they thought their limitations were, if they addressed those, what they thought their strengths were, and how they kind of, how they viewed their analysis of their data. That'll give you a good view if you can trust the article. If they knowingly omit things in their discussion and their conclusions that you, upon further look, really noticed that weren't right, that'll automatically raise a red flag, and you can kind of decide that might not be as high quality of an article based on the author's choice to include in the conclusion. So now to kind of get into a little bit more specifics about each of these kind of things to consider. For population, when you're evaluating the population in a random control trial or any type of journal article, you want to first look at the size. And this is denoted as power, which is generally just the number of participants that were enrolled in the trial. And typically, the larger the power, the greater the enrollment, makes it easier to find a statistical and clinical significance. The smaller your size is, the more or the higher chance you have of having data that's not truly representative and could kind of skew decisions. If you have too small of a population size, it might seem like there's a great effect of a medication, but really it just wasn't tested in enough people. So that'll come into play a little bit with once we get into some of the analysis strategies, but population size is very important to clinical trials and for investigators. And that's often a calculation that's done, before even enrolling anybody. Make sure that you have a large enough population size and enroll enough participants to truly show significant outcomes. And that's often the downfall of a lot of great articles or great trials too. They have a great intervention and great methods, but they just couldn't enroll enough people or people dropped out, and so it became less valuable in the end. You also want to look at population characteristics. So the baseline characteristics of each group, like we were talking about before, if they're skewed and you have one really healthy group and one really, unhealthy group, that's going to make your data seem, less clinically significant, because you're going to be seeing things that maybe aren't due to the intervention, but are instead due to that those innate characteristics of your population. So that's done by evaluating the inclusion criteria and the exclusion criteria. So inclusion criteria are the things that the journal article or trial decided were valuable to have in their patient population. Oftentimes this is a criteria of a disease. So in order to test a diabetes medication, you want to make sure that they, of course, have diabetes. Maybe they've had it for a certain length of time. That could be an inclusion criteria. Another inclusion criteria might be that they've had to fail other medications, so that you know that if you're using this as a last resort, that all of your patients in your study population have had similar experiences in the past. It can also be other just, health criteria such as, blood pressure. A lot of times, inclusion criteria will also include other things that aren't relevant to the topic at hand, but are useful in kind of, like we said, leveling out the playing field and making sure that both groups are as equal as possible. And then on that same hand is exclusion criteria. And this is to kind of make sure that we aren't introducing confounding variables into our analysis by having patients that are going to have these having these extraneous circumstances. A large or very common exclusion criteria is pregnancy. You want to make sure that obviously there's a moral issue with testing medications in pregnant women, but there's a lot of things that happen physiologically when you're pregnant that could potentially skew outcomes and skew clinical response. So you want to make sure you're kind of assessing for those potential confounders and making sure that you don't enroll patients that are going to have those and potentially, again, skew your results. So once you have established your inclusion-exclusion criteria and determine that those are reasonable for the population you're studying. Obviously, if you're studying a diabetes medication, you can't exclude patients with diabetes and have only healthy patients. But those together are going to make your baseline characteristics. And those are often included in trials in a table format, and often they also have their own. And also they have their own analysis done on some of these baseline characteristics so that we can see if, if the groups were similar enough. So a good article will have that analysis done and available for you to look at. And it's also a red flag if you notice that they didn't assess their baseline characteristics, if they didn't factor in the potential difference in their groups as part of their analysis. So that's definitely something you can look at when you're trying to find a high quality study. And then kind of like when we talked about with population and population size, we also have retention and dropout. So oftentimes, even though you've calculated your population size needed, you enroll that many participants, ultimately, unfortunately, some people are going to drop out. They're going to cross over into another treatment arm, or potentially, they could pass away or they could seek other treatment. And that could really skew your final results, especially if one of your outcomes happens to be mortality. It could make it look like one of the other groups is having better outcomes when really a patient dropped out for another reason or died due to another cause of death that has nothing to do with your study. So that's why we have the consort diagram, which can be seen here on the right, and that'll also be something you can look for in a good quality article. The consort diagram will show you how many total patients they assessed for enrollment, how many were totally ended up being enrolled in both arms. So if you're having a treatment and a placebo group, you can see how many were randomized to each group and to which treatment they were allocated. And then moving down, you can also see how many participants made it through to follow-up or actually completed the trial, and then also how many patients were included in the analysis. And there's a couple different ways to analyze those final groups once you finish the trial, and we'll go through some of that a little bit later. But the consort diagram is going to be really helpful to get a snapshot of the population you're studying and whether or not the authors and investigators did their due diligence in making sure that they had equal groups and accounted for some of these confounding variables throughout the trial. Okay, so getting into methods. So once we've established a population, we've randomized them into two groups. How do we go about doing that? So that's one of the big parts of setting up a good, high-quality trial that's reproducible, and also going to be sure that it's valid and not, tainted by any of those confounding variables, such as difference in populations or different in treatment. We want to make sure that we're creating an equal playing field for all participants, and we should be able to see that through the methods. So one thing that journal articles will highlight is their randomization. So you want to assess how the participants were assigned to each group. Going back to our diabetes example, how do we know which participants were assigned to the new medication and which were assigned to standard of care or no care? We want that to be super clear in the method section of our journal article so that we can get a good idea of how it was done. And we also want to make sure that this randomization isn't biased, and we'll get into that a little bit later. But ultimately, we want to make sure that it was done in an unbiased and legitimate way so that the groups are balanced, and therefore we can determine that our outcomes are going to be truly representative of the intervention. Another method that's employed in establishing populations in a randomized controlled trial is blinding. So a high quality study will have the maximum blinding as possible. So oftentimes you'll see double blinded as the standard of high quality. And that just means that both the participant and the investigator were unaware of which patients were receiving which intervention. So neither the doctor nor the participant knew if they were taking the new medication or if they were taking, an old medication or nothing or placebo. We know their outcomes will be the most trustworthy if no one is biased by knowing what they're receiving, because that can lead to a lot of other biases and a lot of other skewing of outcomes that we'll talk about a little later. So we want to make sure that ideally everyone is blinded. Sometimes we know that's not possible. Let's say you're receiving a brand name drug or something with a very notable delivery system, like an insulin syringe. Obviously, we kind of know, or if there's infusion reactions as well, we'll know if it's a study drug or if it happens to be a placebo. Sometimes that's impossible to get away from. But what we're looking for is that the authors did everything in their power to make sure that as much blinding was employed as possible. And this is often done through third-party administration, as well as re-encapsulating products or repackaging products to make sure that patients really don't have any idea of which treatment arm that they're involved in. So this will help make sure that our outcomes are very valid. And the methods, you also want to look into other aspects, such as the location that this trial was performed. So you want to make sure that that this location might have a similar patient population to you, and the patient population you're trying to impact. Not very specific, but if it were performed in a children's hospital, you would know then that these were children populations, children patients, might not be as applicable to a patient or a home with elderly patients. So you want to make sure that you're looking at where it was performed. That could also, the location of where it was performed could also, direct standard of care. So, for example, if you're looking at an intervention for a critical care, let's say someone is in the burn unit, and you're looking at how a new procedure will help them, you want to make sure that you're looking at locations that also have similar other protocols. So making sure that they're getting the same supportive care outside of your treatment. To kind of further describe this a little bit, you want to make sure that everything is as similar in the patient's environment as possible. So if you know another site is going to be using a completely different protocol for caring for a specific type of patient, you know that that's not going to be as valid if you're using a completely different set of protocols, because that's going to inherently make your populations different. So knowing what location it is really going to help you decide if your population is going to be useful or not in this study. Number of sites is also very important. I think it speaks to a much higher quality journal article if it was evaluated or the survey or study was conducted in a number of sites and in a number of different populations. So this will kind of help you kind of get over some of those pitfalls from before. If the populations aren't super similar, this is kind of mitigated by having a wider array of participants across a wider array of sites, so you can have less steep issues with them being, completely different. So hopefully that'll kind of level out how many patients you have and some of their characteristics, so you can get a better idea of how that impact or change is going to impact patients. And also that having a greater number of sites also helps with having a greater power, like we spoke to before. Having a protocol acting in multiple sites allows for, increased enrollment, and hopefully then dropout or, loss of participants is going to be less detrimental to your final outcomes. So a lot of these things that we're talking about, some of the pitfalls or study design flaws, or some of the things we can look for, like mismatched populations or lack of blinding. These are going to help us to determine the internal and external validity of an article. So for internal, this is able to be assessed by evaluating the study design and its methodology. So some of the things we were talking about before, did the authors randomize patients? Did they design a study in a way that was going to be valuable? Did they make a lot of flaws, such as, they didn't randomize patients, so the baseline groups are completely different, and therefore we can't really tell if medication helped at all? That means that a study would have poor internal validity. And that's something that we can assess on our own, and we don't want to include a study with poor internal validity in our final assessment or, our final research, because we know that whatever outcomes that they reported can't truly be trusted and aren't truly, vetted. And that, like we mentioned before, is kind of determined through our baseline populations and making sure those are similar, as well as some of those other tools when developing a trial, such as blinding, as well as randomization. So those aspects are what are going to make a study or a journal article have high internal validity. As for external validity, this is how we determine or how we evaluate if the study is going to be applicable to others. So this can be kind of evaluated if we think about the last slide, the location. So if a study was performed in a similar location to the one I'm working in, the populations are going to be similar, the interventions might be very similar, then we know that this is something that I can apply to my patients. And this is something that will be convincing if I were to present this to someone else. Studies without good external validity, they might be really strongly designed and might have really great outcomes, but they just weren't performed on a patient population that is going to be helpful when thinking about a disease state. So going back to our diabetes examples, if we study a new diabetes medication in a population of children who don't have diabetes, then saying that yes, obviously they have great blood sugar after receiving this medication, we know that that doesn't have great external validity because we can't really apply those outcomes to our perhaps older population with different disease states. So we know that, yeah, while the outcomes may look great, we're not really sure if they're a study or the patients that I'm trying to guide care of, because they just aren't applicable to each other or are similar enough to make that information valuable. And this is also telling us whether or not the methods can be employed in other settings. So if a particular site has different tools or different personnel that are able to do certain things, or if they have different infrastructure, they might be able to employ different methods. So you want to make sure that, if they have certain tools, that you also have those tools to use in order to make sure that your trial or your research is going to be useful. So this is just going to talk a little bit about bias and how that arises. So at the baseline, bias results from, randomization and blinding. So an inherent form of bias is the groups weren't truly equal to begin with. So therefore, our outcomes are going to be biased and not as reliable because we're not sure that each group was impacted in the same way. Conflicts of interest are also of note. Oftentimes, if a drug company is funding a trial for one of their new drugs, we have to make sure that they're not selectively promoting positive outcomes and that they're, reporting all the outcomes. So we want to make sure that there's no conflict of interest when we're trying to evaluate the validity of a paper. And then just a few different types of potential bias that can arise throughout, the methodology, as well as just throughout some of the outcomes collecting and analysis. We have selection bias, which means that there was an issue with assigning participants to each group, as it's not random, and could be based on some other baseline characteristic that could skew final outcomes. So putting all of our patients with the most severe diabetes in one group is not going to help us decide if the treatment is useful or not. Attrition bias is what happens when patients drop out, and this kind of destroys that initial state of randomization between groups. So if you have an unequal dropout in your treatment arm, you have more patients and therefore higher power in your non-treatment arm. And those are just a few examples. There's so many different types of bias that can arise. So you just want to make sure that you're kind of evaluating these things and looking into them when things don't seem quite right. It's okay to be skeptical and making sure that you're doing your due diligence. So making sure that all of the outcomes and all of the methods that are presented to you make sense. And that's going to be your role when you're critically evaluating a journal article. So just generally outcomes. So we've kind of gone over this a lot up until this point. So we want to make sure that the data collected is relevant. We want to make sure that they're organized in a way that are useful. And that can be done through, establishing primary outcomes such as, heart attack if you're looking at a cardiac medication, secondary outcomes, perhaps loss of quality of life after a heart attack, and then potentially surrogate outcomes, which could be, heart rate and blood pressure in evaluating cardiac health on a new medication. So you can kind of also use other outcomes and other lab markers to assess. And then additionally, the outcomes are going to be analyzed in some way, and they'll be presented with a statistical analysis. So that's kind of your job as a reader and a reviewer to kind of assess that they made good choices in how they analyze their outcomes. So coming to statistics, are the positive outcomes of interest, the ones that have come out of this study, are they due to chance alone? So would this have happened without any sort of intervention? Are they a result of bias? So the groups were unequal to begin with, so we see a much better outcome in one group over another. And if both of these are false, which we are hoping to prove that they're false, then we can say that they're due to the intervention themselves. So that's our ultimate goal, is to disprove chance and disprove bias. So statistics help us, like we mentioned before, determine if those outcomes are due to chance, bias, or if they're truly due to the intervention that's been in place. And it's a means of evaluating the validity and strength of our outcomes so that we can use them to further our own research. So I'm going to briefly go through a few tools. This could be its own class and its own webinar altogether. So I just want to give you a brief idea of how outcomes can be represented in papers. So you have absolute numbers, and that would be how many subjects in each group experienced an event or outcome. And this is just based on, an absolute risk reduction. So compared to their baseline of each group, this is how many people experienced the outcome of interest compared to how many who didn't. So they're standalone differences from baseline and can be used to kind of assess if our groups are equal, how the intervention actually worked. And that would be our absolute risk reduction. Oftentimes they'll also describe it in relative risk reduction, which this is the likelihood of events compared to each other. And this is less useful because you really don't know the baseline. So you can say that if one experienced events at a rate of 6% and one experienced events at a rate of 8%, we know that one group is 25% more likely to experience an event, but we don't really know how likely that event was to begin with. So it's a little less useful in kind of determining absolute outcomes, but can be useful in comparing groups and comparing interventions. The hazard ratio is used to describe relative events and their timing. So it'll help you see, how many patients experienced an adverse event and in what time frame. So there's just some guidance there down at the bottom to kind of assess whether or not, that's a good thing, or if it's, they're experiencing rates at twice the amount of the treatment group, then maybe, yeah, there is something clinically significant there, something further to look into. But if they're experiencing events at the same rate, we can kind of ignore that in a sense. And then the confidence interval is our allowable margin of error. So it provides a plausible range of values that this actual effect could be observed. But it's not a probability of magnitude. It's not going to tell you how great the effect is going to be, but it'll give you an idea of where people are responding. So just a general rule of thumb, if the confidence interval includes 1, we can determine that, the outcomes are not statistically significant. So we want to make sure that that's something that we're looking for as well, and that's something that you can evaluate. P-values are the most common statistical analysis tool I think that we see in randomized controlled trials. And a p-value is going to show you how often a result could occur by chance alone if there were no difference between our groups. So we're under the assumption that, our groups are equal, they're balanced. So we're trying to see, would it be more likely for this just to occur by chance, or is this really as a result of the intervention? So generally, p-values less than 0.5 are deemed to be statistically significant and useful. And just an example of that is a p-value of 0.04 would mean that 4% of the time you would have similar outcomes by chance. So if they had improved, cardiac function or improved health, you want to make sure that, it's less likely to happen by chance and more likely to happen with your intervention, such as a new medication. So the lower the p-value, the more likely it is your intervention is responsible for your positive outcome. And then these are just ways of kind of assessing total outcomes. So kind of going back to that consort diagram at the end, when we have all of our patients who've completed the entire trial and a completed follow-up, we have to analyze all the data we have together. And this is done in 2 different ways. More common is the intention to treat analysis, and that means that all subjects that were randomized in the beginning are included in the final analysis, whether or not they dropped out, were lost to follow-up, or just didn't complete the trial. And this is used to avoid the effects of those dropouts, which could then in turn detriment that initial randomization. So you had a really strong randomized group of people, and then because, more in one group dropped out, now your outcomes are skewed. Using an intention to treat analysis will kind of help avoid some of those pitfalls. But on the other hand, a per protocol analysis only analyzes subjects who completed the entire study and follow-up. And only those patients are the ones included in the final analysis. So while this does reduce the chance of falsely concluding non-inferiority, it does, kind of go back to that first point. It does make it a little less skewed and doesn't really give us the full potential outcomes that we could be analyzing. Instead, we're kind of left with maybe a group that's not truly representative of what could have happened in that study. So we want to make sure that there's a good mix of both, and that whichever analysis the authors chose makes sense and is useful for whatever analysis they're trying to perform. So just very quickly, some false negatives, false positives, as well as true positives, which is what we're ultimately looking for. So a type 1 error, or alpha, means that you would reject the null hypothesis when the null is true, and this is a false positive. So what that means is that you're rejecting that there is no difference and saying that there is a difference when there truly is not a difference. And this can be due to a number of reasons. And then more common is a type 2 error, and that's referred to as beta, and that's a false negative. So this one's a little bit more dangerous and is usually described, it's been described to me as, putting a criminal on trial and saying that he's innocent when really he's not innocent. So then it becomes more dangerous for the population. Now you have someone who has gone free, and that can be a little bit more dangerous than, unfortunately locking up an innocent person, right? So if you accept the null hypothesis, you accept that there is no difference between the 2 outcomes. When there is in fact a difference, you'll have a type 2 error. And this is directly tied to population size. So a greater population size is going to really reduce your chance for type 2 error. So that's why enrolling enough participants at the beginning is super important. Excuse me. Establishing a high enough power is super important in avoiding this this false negative outcome. So once you kind of look through your whole paper, you've analyzed its methodology, you've analyzed its outcomes and its analysis. Now you have a chance to summarize and present those results. And people do that in a number of ways. Individual random controlled trials, kind of like what we went through today, can be summed into a systematic review. So anything you put into a systematic review, you want to make sure that each individual piece has been vetted and analyzed and make sure that it's high quality. So if you're coming up with a review paper, you want to make sure that each citation you include has gone through this critical appraisal process. Journal clubs, that would be a standalone presentation of a single article or trial, and that will kind of go through analyzing a lot of the steps we did today, and then presenting it to another professional or another group of people to kind of highlight some of the strengths and weaknesses of particular articles, especially when it's about new medications or new therapy guidelines. You want to make sure you're having critical discussion as a group and making sure that it's well backed up. Oftentimes, this critical analysis will go and feed into guideline development. So kind of like with systematic review, you want to make sure that each individual trial that you're assessing that's going to eventually guide therapy has been really well analyzed and really picked apart before, making treatment recommendations for a whole group of people. We want to make sure that those things apply, that it's the population that's similar to the group we're trying to treat, so that the guidelines we're implementing make sense. And that's done by making sure that the data and the outcomes that we have also make sense. And it also is used every day in guiding patient care decisions. So looking at randomized controlled trials in primary literature, I think is very valuable to you as a practicing and future practicing pharmacist. You're going to get questions hopefully all the time from other professionals on how to, optimize care for a patient. And you should be able to use some of these critical appraisal skills when looking for resources and looking for evidence to kind of guide you how you will answer. So making sure you have those skills is going to be really important as a professional. And this is just kind of an example of what the components of a journal club specifically might look for. So these are some of the things you can kind of focus on and talk about when you're presenting talked about and looked at and analyzed all of these different components of the trial that you're looking at. And then lastly, I'll leave you with some potential pitfalls. So kind of like we talked about in the beginning, avoid echoing the author's conclusions that are presented in the results and discussion. So you want to make sure that you're doing your own analysis and not solely relying on what the authors have said, and making sure that those authors are kind of telling the truth and making sure that their outcomes are reliable. If results seem too good to be true, unfortunately they probably are. So that's when you have to put on your critical appraisal hat and make sure you go back and look at how the data was collected and how it was analyzed to make sure that those are true outcomes and that they're not inflated or more positive than they actually are. And then also be sure to compare outcomes of any trial or journal article to previous works of similar nature. So if something's way outlandish or way different than things that have been studied and presented in the past, you want to make sure that there's no real errors in the journal article or the trial that can account for that. So just making sure that things are kind of similar, but obviously breakthroughs happen every day, but you just want to make sure that those breakthroughs are, came about in a well-designed way. And then I just leave you with some useful resources. We went through kind of a randomized controlled trial, very clinical, but a lot of these websites will have critical appraisal checklists for a variety of different paper types, including qualitative, meta-analysis, as well as some other things. So if you need more information or more resources, these are here for you to kind of like browse through and kind of look for new tools you can use. And with that, I'm sorry, it was a little bit of a lot, but hopefully if there's any questions, I can answer those for you. I'll do my best.
Thank you, Margaret, for the very elaborate and educative presentation on critical appraisal of journals, articles. I have learned a lot, and I trust that our attendees have learned a lot and also have questions and clarifications or comments. So since our time has been fast spent, I will read out one question that I have here for you. Um, if you still have any other questions, please feel free to type in the chat box, and we'll be happy to attend to you. Yeah. So Margaret, the question is from Heidi, and the question is, as a college student, how would I improve my critical skills and publications, even in a non-pharmaceutical field, psychiatry, for example? So do you have any recommendations for these, or where to go for Heidi?
Sure. You just what was the last part in which field?
For example, in psychiatry, like non-pharmaceutical stuff.
Oh, sure. Kind of like we talked about at the beginning, this is a skill set that's used across all professions. So my recommendation would be to start looking through some of those journals that are published on psychiatry or psych medicine, and you can kind of look through what's been published. And there will be some of these tools on this resource page that are kind of all-encompassing and aren't specific to pharmacy. So you can use these skills across all different types of articles and across all different types of disciplines. And I think practice is a big part of it. It can be really easy to miss things if you're not super accustomed, looking for them and looking for those red flags. So I think practice is definitely a big part of getting comfortable with critically analyzing a journal. And you can kind of see what's been included in guidelines. And if those articles have been vetted, so you can kind of see what a high quality article would look like and use that as a guide. I think that would be really helpful in kind of, going out on your own and reading new literature, is seeing what's been deemed valuable in the past.
Okay, thank you, Margaret. And we have another question. If the guidelines suggest something different from a critical appraisal, which one should we refer to? This is
Sure.
Yep.
So yeah, this is something that we get, at least in my institution, we get a lot of. So one of the tools or one of the kind of checklist items that they give us is make sure that you're evaluating multiple sources. So if a guideline is telling you one thing, but you're trying to find information that supports something else, just making sure that you're checking, primary research, so direct trials, guidelines, which would be more of a secondary and tertiary resource, and then also looking at, opinions of other professionals. So I think if you culminate all of those different things and look at the conclusions from different types of research, you can kind of even though the guideline doesn't say one thing and you might have 5 other articles from 5 other researchers that are showing you different outcomes, you can use that to kind of argue your point. Might not always go over well if you're trying to, go against guideline decisions in an institution, but that's how you would go about forming a well-educated answer, is making sure you're looking at least 3 different sources, if not more.
Okay, that was really helpful. Okay, so one last question, Margaret, is from Habiba. The question is, can you explain type 2 errors again?
Sure. So let me go back to that slide. All right. So type 2 error, otherwise known as beta, this is at the baseline when you accept the null hypothesis when the null happens to be true. So what this means is your research hypothesis that you were looking to find does happen to be true. So there is a difference. So this would be saying, a diabetes medication is helpful in improving someone's diabetes. That's what the outcomes are showing you. But instead of accepting that, yes, this medication is better, due to, a decrease, a small population size or other factors, you decide to go with the fact that there is no difference. So what you're saying in this case is that, even though the medication is helpful, my outcome or my final analysis, my statistical analysis is showing that both are equal, that it doesn't matter if they got treated with the medication or not, their outcomes would have been the same. And that's a false negative. So that just means that, you could have really shown that there was a significant difference, but due to issues with your methods in the beginning or, patient dropout, now you kind of have an image or a picture that's showing you less clinical usefulness. So we can decrease that type 2 error potential by having more participants enrolled, having more, breathing room for dropout, so that we can actually, at the end, really assess if there's a true outcome as opposed to, not being able to statistically conclude that. Hopefully that clarified it a little bit.
Yeah, thank you. Another question is from Yalda, and it's still about the error types. The question is, why is the type 2 error more dangerous than type 1?
Sure. So this was when I took statistics, this was described to me as if you were, putting a criminal on trial. So if you had someone who was, robbing banks, and you had them on trial, and eventually you decided that no, they're innocent, which would be what accepting the null hypothesis is, that there's no difference with this person, because that would be what accepting the null hypothesis would be, that there's no difference. This is more dangerous in, clinical trials, because now you're letting that potential effect go unnoticed. So if you have a criminal and you say that he's innocent and let him go, he might, commit more crime. So that's a little bit different than if, for type 1, if you have a criminal or if you have a normal individual, like a normal citizen, and accidentally put them in prison, while that is unfortunate for the individual, it's not dangerous to the rest of society. That was always just a very interesting example that I was given. But I think in terms of like clinical relevance, the type 2 is just a little bit more dangerous because, and that's a kind of, maybe that's not the right word to use, but it's a little bit more detrimental to your research if you're missing potential effects that could be there. So that's kind of what the type 2 error does, is kind of hides potential effects that could be there.
Okay, thank you, Margaret, for the clarification and for the whole presentation. So we'll be running to close this session now. But before we do that, there is an important announcement that Margaret will want to make for everyone here today. So please listen and take note of the announcement, and also kindly fill out the webinar evaluation form. It's on the chat box. I've been sharing the link, and fill it out with your proper name so that you will get your certificate of attendance. Thank you very much. Margaret, over to you now.
Sure, I see that we're kind of approaching the end of our time too, or definitely over. But thank you guys all for your attention. Hopefully it was useful. And if you have any other questions, feel free to reach out to me with the provided email. But I just wanted to plug our call for research articles for our 2020 edition of Future. Future is IPSF's research publication. So we accept original research from our members, as well as review articles and analysis papers. Here we have a list of examples of potential topics for this year. So if you have any experience or ongoing research, or if you want to kind of employ some of these critical analysis skills that we went through today, I encourage you all to submit an article for publication for this year. And I'm noticing I didn't put the deadline on here, but the deadline is going to be at the end of May. It's going to be May 26th, a Tuesday. So the call is here linked for you, and you can view the PDF. And you can also submit your articles finished to this Google form. But if you have any questions, feel free to shoot me an email as well.
Thank you very much, Margaret. Just 1 minute. I'm trying to share out the link of the call and Google Form to everyone on the chat box. Then
Perfect.
we will be over with and done for today. Like, it's been a pleasure having you all attend the 4 different webinars that we've had over this period of time. I hope that this has been great learning for you, and also to tell you that the responses that you provide on the evaluation form is serving as a guide for us to prepare more interesting webinar sessions for you. So please feel free to write your comments and what else you would like the pharmacy education portfolio to do for you. And I think I will call it a day here. Thank you for joining us, and have a great day, morning, afternoon, night. Bye bye, everyone.